Nashville has its first Omicron COVID-19 case. The man who contracted it was fully vaccinated. And News 4's Alexandria Adams is live outside of the Metro Health Department with more on this. So, Alexandria, a lot of questions about this morning. Do we know the exact timeline as to when this man started feeling some of these symptoms that he was feeling sick?
Brittany, this man tells us that his flight landed here in Nashville after traveling to South Africa. And shortly after, that's when he started to notice those mild symptoms. Immediately, he got tested after noticing the symptoms and he stayed at home. He did not have to be hospitalized. The man also had already had his booster dose. Dr. Alex Jahangir with the Metro Coronavirus Task Force says this man took the right steps.
Felt some symptoms, went and got tested, and stayed at home and prevented spread to others. It's also important to remember that the vaccines are not 100%, it's not 100%, but they really are pretty darn high to preventing people from getting hospitalized. And what I don't know is what if this person wasn't vaccinated? Would they have been put into the hospital? Would they have potentially died? We don't know that, but they did exactly the right things.
The news comes as the state's vaccination rate is a little bit more than 50%. Dr. Jahangir, that you just heard from right there, recommending that everyone gets that vaccine if they don't have it already. And if you have gotten your vaccine and it's been more than 6 months, well, he says that it's time to get that booster as soon as possible. When I come back in about 30 minutes, I'm going to be sharing why the CDC Advisory Committee is no longer recommending the J&J vaccine.